When you have not paid people for 4 to 7 months, you expect them to go to work when they are not even able to pay their transport to work or give their family basic food to eat. Now that are you going to tell and give excuses to your landlord that you're not able to reach out to pay for the rent because you have not been paid for months? Or are your children are sent back from school that you cannot meet up with the school fees? What do you tell them? These are questions we need to ask. We gave a government ultimatum on the 31st of January 2021 regarding the welfare of our members. We gave about 10 points to the federal government and states. From the one who lost at the 7th of February, we lost about 19 members to COVID-19, and then before that time of last year, it was said that all health workers will be insured. But it stands, up to now, no death and service insurance have been paid to any of the next of kin of the members we have. We have interns, house officers, about 114 of them that are still being owed various salaries. And also a letter came out from the head of service telling us that they have been removed from the scheme of service, which was adopted by the Lagos state. And since then, now they are out of the scheme of service and nothing can be done about it. We have residents under the GiftMix platform, which is a non-regular platform for payment for doctors who are employed by the different hospitals. And since then, so the hospitals have to hire resident doctors on the temporary platform, which is the GiftMix platform, which is used to pay them, and they are later migrated into the IPs. The IPs platform is the regular platform which they are employed to. Part of our MOA we signed on the 31st of March and an addendum on the 9th of April was that those resident doctors will be migrated into IPs so that they can be regularized. But as it stands, about 4 to 7 months of their salary have still been withheld. Capturing was stopped by the head of service. And that's where we find ourselves at that stage. On the hazard allowance, we have been having discussions with the Presidential Salaries Committee for some time, and the last invite was supposed to be like 4 weeks ago, which was stopped. And up to now, we have not had anything from the Presidential task force on that. And the status quo remains the same. For those, there are shortfalls of salaries of 2014, 15, and 16 that was agreed upon to be paid to all resident doctors and house officers. But up to now, nothing has been done about it. The minimum wage consequential adjustments have nothing been done about that also. The other thing there is also the medical resident training fund, which was omitted from the budget. But through the help of the Speaker of the House, Femi Baji-Amela, it was put into the supplementary budget, and hopefully we are working on that. We were given a court summon on Friday last week in the NIJ, National Industrial Court, where we attended the court on Monday this week. But fortunately for us, the judge felt that we have not had adequate briefing, and it was adjourned on the 15th of September next month. That's where we stand up to now. All this I just said, the 99 or 10 things I just said are all federal. As officers in terms are under federal, not state. The head of service removed them from scheme of service is federal, not state. Members of the GiftMix platform have not been paid 4 to 7 months salaries are federal, not state. Their capturing was stopped by the head of service of the federation, not state. The medical resident training fund is also federal, not state. The minimum consequential adjustment is federal, not state. The shortfalls of 2014, 15, 16 is federal and not state. The medical resident training fund is also federal and not state. The hazard allowance is also federal and not state. So that means I've mentioned about 9 things now, which are all federal and not state. Yes, the Minister of Labour took us to the National Industrial Court and asked for permission to apply no work, no pay on our members. Yes, it's sad that they are quick at applying the no work, no pay clause. But what happens to those that failed in trying to honor the memorandum of action where we agreed on over 151 days ago? If those people that signed the memorandum of action with us, which had a time span, what have been done to them in achieving those MOA? Assuming the MOA was honored, are we going to be? We won't be in this problem we are in. So they should also be called to book in honoring what they have signed with us. Basically, it's. Even with the no work, no pay, and the bullying and calling of names, telling us that we'll be sacked. Today is about 17 days since we started the strike, and we are still going on. That shows that we are not being bullied. We are resolute and want to go all the way in achieving the best for our members. I guess you have been paid for last month. So what would you tell people that have not been paid for 47 months in the federal, and 19 months in the state, like in Abia State, 8 months in Imo State, 6 months in Ondo State, and 4 months in Ekiti? If you are able to answer that question, I'm home and dry. People are hungry. They have not been able to eat. Their children are sent home back from school. The landlords are giving them time and giving some even out. They can't even afford to get transport to go to work. So which one is worse? You understand that kind of a person to go to work? You can't, and it's obviously true. Let me take you back in times. In the 1950s, University College Hospital in Ibadan used to be a reference ground where people come from other climes to Nigeria to seek healthcare, from Saudi Arabia, from the United Kingdom, and the rest, because we knew that at that time the health system was well developed. But you agree with me now that most of the health tourism has been now many of our leaders go through now has taken a chunk of plenty of the money that is meant for doing other things, developing the health sector in Nigeria. It has been a big thorn on our flesh because most of them tend to travel just for checkup for ear infections, headaches, and stuff that can actually be treated in Nigeria. The annual budget for the clinic in Aso Rock is in billions. Meanwhile, you cannot see even the best things in the Aso Rock clinic. You can agree with me that if you go throughout the world, throughout Nigeria, there's no zone in Nigeria presently that have good functional hospitals that you can equate with all other hospitals in all of other countries. You don't have MRIs, you don't have CT scans, you cannot treat cancer. Most of our people travel to India to get treatment. If you go by our budget is about 4% of the budget of the country, when about 25 to 50% is meant for paying those in the upper and lower chambers. It shows you where our priorities lie. We have not taken the health system structure importantly. That is why those that can afford to travel out tend to travel out and see us all the other ones suffer. That is where we find ourselves. There have been plenty of silence from the Ministry of Health, who are our primary employers. They are where the problem really comes from, the Ministry of Health. Because you tend to come, you see them, you have a meeting with them. They shake their heads and put their pen to paper and try and jot down what the problem is. As if you are bringing one new problem for the first time. But the next time you come back, there's nothing done, and you start all over again. I think the beam line should be shared on them. If they are able to stand up to their responsibilities, we will have less strikes in Nigeria. Plenty of less strikes. We have had meetings with the Minister of Labour, which we held yesterday, and the House of Rep Committee Chairman on Health, Dr. Katango has also been in contact with us. So we are using those windows to see if we can get things sorted out as quick as possible, and we go back to work. The minimum demands are: one, members on giving platform should be captured and enrolled into the IP's platform, and the allowances for 4 to 7 months paid to them. That's one. Two, the minimum shortfalls of 2014, 15, 16 and the minimum rate should be sorted out. And the circular on House of Stars should be sorted out. If we have those, we should be able to go back to work, and we can work on the other ones.